Yeah, so whenever you check in our office in the new patient, you're just gonna go check in here at the front desk. Um, and then they'll basically give you an iPad. Pretty much everything we do here is digital and electronic, so you'll just do all your new patient paperwork. If you haven't done it online, we'll have you fill it in or fill it out in the office on the iPad here. Then our front desk will actually assign you a special patient pin so that you can just log in on the iPad kiosk for each one of your visits, and that way the doctors will already have your charts and everything pulled up when you get here. But yeah, if you want to come with me, I'll show you around. This is just one of our exam rooms. We have a couple here in the clinic, depending on which doctor you're seeing. So yeah, you'll sit down, we'll do a good consult. Just have you laying down on your tummy, just nice and comfortable, just do a really good exam so we can feel what's going on with you, what you have going on and what you actually need. A lot of times patients do need some level of therapies. So you can see Matt's over here lasering himself. But we've got a class 4 laser that he's actually using. We actually use cupping for soft tissue work. We do trigger point therapy for soft tissue work. So if you've got some muscle spasms and things like that, or if the muscles are actually a big part of your problem, we want to make sure that we address that, and we do it all in here. Once our patients actually progress, one of the things that we'll do is have them move on. So you don't always want to be doing the same thing over and over, because that means you're not going through the full, like completing the healing process. So as much as patients are sad to say to not get that muscle work anymore, they actually have to start doing some things on their own. It's a necessary part of the healing process. So we have some stretch bikes. So just depending on what's going on with the patient, we'll have them doing different prescribed stretches on here. And then we also have them doing some exercise, some balance and stability exercises on these different Bosu balls. You can see how they're all a little bit different in size as far as how high they are, and that just has to do with the difficulty level in doing that. So that actually, believe it or not, is a big part to getting like a chronic back problem or a chronic neck problem stabilized. So we don't want to skip anything that's going to make this just be a temporary result for you. So yeah, we have 2 adjusting bays. They're actually even numbered 1 and 2. So it just depends on where our front desk tells you to go. It just makes, us knowing where each patient is at easier. So this is the adjusting area. We've got one on the other side. They're exactly the same. So I always like to adjust the neck and the chair, but our other doctors do have different techniques, especially for the neck. But for everything else, we pretty much adjust the same way. This table is really interesting because more than interesting, it's just really effective. So it's for the mid and upper back. And the great thing about it is you can just walk up to it, lay on your tummy, and then it will lower you down. Really, this table was created for patients that had like really bad, like debilitating back pain of some sort, to the point where they couldn't actually physically get on the table themselves. And then we'll bring you over here for the low back adjustment. So again, we have a lot of different adjusting techniques. It just depends on what the patient's needing, but this is usually what gets you on your side and deliver a pretty typical low back adjustment. The one thing that we just do that's an added touch to it here is, again, prior to any adjustments being made, there is a detailed exam. There is really thorough x-rays, and we also do the motion study x-ray, which is really unique because, again, we want to see where everything is shutting down. So when we deliver these adjustments, we want to make sure that we're on the exact segment, the exact level of the spine that needs to be adjusted. We're pushing in the right angle and degree so that we can get the very best result. We just don't want to do a couple of pops to get some temporary relief. We want to actually be in there physically correcting the problem. Yeah, and so it pretty much only takes a couple of minutes to get adjusted, and then it's just a matter of that. After that, it's just a matter of just letting yourself out of the space here. And then, of course, you'll just return to the front desk for the checkout process and for any future scheduling. Our scheduling here is really simple. Once, of course, you get established as a new patient, which takes those are kind of like the longer of the 2 visits, then you're in our system. You have a consistent schedule. You can, and if you need to move anything around, you can always just text the front desk. We're super text friendly, and we're set up with automatic reminders. So everything is pretty much just like once it's set, then you can literally forget it, and then you just listen to your phone, and it'll tell you when to come to your appointment. So it's pretty simple.